It could deeply impact the future of women's health care in Texas and how many children are born in the state for years to come.
Today, a bill some say is one of the toughest abortion restrictions in the nation is before Texas lawmakers. And it's quickly shaping up to be the most controversial topic of this special session. KXAN political reporter Josh Hinkle has our top story.
For years, Amy Hagstrom Miller had a vision of an abortion care facility where women could have a quick procedure and comfortable recovery.
We're going to go down here to the aftercare room where patients come post-procedure to relax.
But soon, Whole Women's Health in Austin might have to trade the cushy recliners for hospital stretchers.
In an ambulatory surgical setting, this room would need to be about 4 times the size.
As lawmakers consider requiring clinics like this to be surgical centers.
So there's a whole bunch of requirements that have to do with airflow, temperature, humidity, size of the room, that kind of thing for operations that may take 3 or 4 hours. But for an abortion that takes 5 or 10 minutes, it's sort of mismatched.
Especially for something she says is usually very safe.
Well, there are complications from abortions, and those are very serious, and we do need to have safety standards so that women can be properly taken care of.
Supporters of the legislation, like the Texas Alliance for Life, say it could drop the number of abortions in Texas, but it also makes healthy sense for women.
This is a list of more than 400 licensed ambulatory surgical centers throughout the state of Texas. If they can meet those safety standards, why can't the abortion providers?
Texas has 47 abortion clinics, but only 5 are also surgical centers. Only one of those is in Austin, and it's not Hagstrom Miller's.
It is a needed healthcare service.
If the bill passes, she says most clinics can't afford the upgrades. She's not even sure this place will stay open.
It's going to have a tremendous effect on Texas women.
A Senate panel is hearing testimony on the legislation right now. If it makes it to the floor, it has a good chance of moving forward because during a special session, the rules are suspended and Democrats will have a tough time blocking this bill. At the state capitol, Josh Hinkle, KXAN News.
The surgical center requirement is part of a larger package lawmakers are considering now. Another measure would ban abortions after 20 weeks of pregnancy. Another would require doctors performing the procedure to also have privileges to work at nearby hospitals. And still another would require doctors to administer abortion drugs in person according to FDA standards.